My name is Tessa Churchill. I am an anesthesiologist at Endeavor Health in Chicago. I have been a board member since 2018, but I actually became affiliated with the board initially earlier than that. I was in business school. I was taking a class about board governance. And as part of the class, you actually worked with a nonprofit board and did a project for them, anything that they needed, any work that they needed done. And my project was centered around looking at patient resources and trying to determine whether or not we were providing what patients were expecting from us, essentially. So I talked to patients and I did a survey, and I was trying to see whether or not we were actually providing the resources that they expected and if there was anything else that they needed from us. And then a couple years later, in 2018, a couple of the board members actually reached out to me and asked if I wanted to join the board as a full-time member. They had recently gotten Gretchen Vaughn on board, and they basically said, there's a lot of big changes coming, and do you want to be part of it? And I said, yeah, let's do it. So that's how I initially became involved. And I think one of the big milestones that I remember and was really excited about was the think tank, actually. When we had lots of conversations about what are we going to do to bring people together. We can fund research. We've always funded research, and that funding has increased over time appropriately. And we are always focused on bringing new researchers in and getting people involved with kidney cancer in particular. But I think the think tank was really a turning point in that we were literally bringing key opinion leaders together to talk about what does the future look like. And that was really exciting for me. And out of that came consensus papers and further thought about where we could go in the future. And so I thought that was a big moment, and that was exciting for me. As far as the kidney cancer landscape changing, I think a huge change that has happened over the last few years is just that the community has grown. And the Kidney Cancer Association has been a huge part of that. I credit a lot of it to Gretchen and her team for really fostering partnerships with other organizations that have the same goals that we do, to find a cure for kidney cancer and to support those who are going through this terrible disease. And I've seen over the years the relationships grow, the ability for people to get together. I mean, the Kidney Cancer Association has put together regional workshops, patient symposia, online like peer-to-peer support groups, and all of that I think has made a huge impact in patient support, essentially. I mean, they feel like there's a community out there now that never existed before, and I think that that really helps people get through difficult times in their lives and to feel less alone. So that's been huge, and I think that as we continue to grow the community, it only helps foster getting to those final goals that we are looking towards: curing kidney cancer, finding treatments, and just supporting everybody through it. I can only hope that in the future we continue to come up with more treatments and cures, and the Kidney Cancer Association has always funded research for this, particularly in today's political landscape. I mean, it's more important than ever to get funding for research and to get more researchers on board and trying to find a cure and to work for treatments for people. So I know that the Kidney Cancer Association will always be a huge part of that, and it will only continue to grow as the years pass. But I also know that we are working on several new programs, and we will always continue to kind of push the boundaries of what we can do for people and how we can get people together and raise funds to help all of the stakeholders who are involved. So I'm sure that the Kidney Cancer Association will continue to be a huge part of that. So I have been on the board for 8 years, almost 8 years now, almost a decade. It's been a long time. And I have just made some great relationships with people that I hope to carry through, far into the future. But really, the biggest impact on me has been getting to see the transformation that has happened in the organization and getting to see the number of people that it has helped. every year we look at numbers of people that we are providing assistance to, that are coming to the website, that are getting research funding, and every year it grows. And I think that that has just made me so proud of the work that we have done and so proud of being part of it. And yeah, it's just been a great experience all around.